Good morning, good afternoon, good evening, depending on where you are. And it is my great pleasure to share with you the Korea's public health responses to COVID-19 outbreak. So you can see the outline of my talk from the screen. So I will just skip the outline. The next page, please. So with continuing threat of emerging infectious diseases, the concept of the health security has emerged several years ago. And with current crisis we are facing is teaching us how the virus can be really devastating and with a huge impact on economy and also all aspects of our lives. So with that background, the Global Health Security Agenda was initiated by United States and endorsed by G7 in 2014. Now with the 67 member states participating in that agenda, and there is a steering group of around 10 countries. Current chair is Netherlands, and Korea was chair in 2017. And recognizing the importance of evaluation of the action packages area in global health and public health, the evaluation mechanism was introduced, and that was extended to the joint external evaluation tools with 19 technical areas in collaboration with WHO and OIE and FAO. And Korea also participated in JEE in 2017 as a chair country of GHSA steering group. And this provided a good opportunity for Korea to show how much the public health national emergency response capacity has been strengthened, especially after MERS outbreak in 2015. And this photo actually shows the WHO Korea joint mission, which happened in 2015. So you probably know the WHO China mission, which happened about 2 months ago. And this was similar mission in Korea during the middle of MERS outbreak in Korea. So there has been many lessons learned after the MERS outbreak, and government took the action following this outbreak. In terms of governance, firstly, Korea CDC established dedicated emergency operations center and also laboratory analysis center dedicated to the emergency control. And also Korea CDC established regulatory framework for the emergency use licensing in collaboration with Ministry of Food and Drug Safety. And also in terms of infrastructure, government tried to strengthen the various facilities, which is important for the public health emergency. Also, there was good collaboration between the ministries, Ministry of Interior and Safety, and Land and Infrastructure and Transport, and as I mentioned, with the Ministry of Food and Drug Safety. And also we realized the importance of risk communication because there were some issues on transparency. So dedicated team on risk communication was established, and you can see the daily briefing for the COVID-19 since the first day of the case in Korea. So every morning and afternoon has been a briefing to the public and media. Next slide, please. So I just want to show you briefly the recommendations of WHO COVID-19 Emergency Committee. So as a member of the Emergency Committee, I strongly recommended to organize WHO China Joint Mission to address the situation and also to assess China's response to COVID-19. And this actually happened during the February 16 to 24, and 25 experts led by Dr. Bruce Award participated in the mission, and mission provided detailed information on the situation in China. And committee also recommended to provide support to countries and regions with vulnerable public health infrastructure and collaborate with them to WHO. Also to China to conduct exit screening to identify the infected travelers and to minimize travel restrictions from China to other countries and to cooperate with WHO and other agencies. And committee also recommended to all countries WHO shall not immediately recommend any travel or trade restrictions based on current information available, and to be cautious not to promote stigma or discrimination against specific groups in accordance with human rights principle of Article 3 of International Health Regulation. And based on these recommendations from the Emergency Committee, according to the IHR 2005, WHO Director General declared the public health emergency of international concern on January 30th. So I want to just briefly show the timeline of early stage of public health responses in Korea. So on January 3rd, the Korea CDC activated Emergency Operations Center and strengthened entry screening. On January 6th, it allotted clinicians to look out for patients with respiratory symptoms with history to visit to travel history to Wuhan, China. And January 4 and 8 Korea CDC developed and distributed guidance for the national designated isolation hospitals for clinicians. On 17th, the guidance, the testing and management of COVID-19 and the guidance for the local government was distributed. On 20th, the government scaled up alert level from level 1 to level 2. So from this timeline, you can see that government took very early actions even before the emergency state was declared by WHO. So if we see the South Korea's responses to COVID-19 in different areas, firstly for testing, as I mentioned, that there was a preparation of COVID-19 testing kit for the fast track in collaboration with Ministry of Food and Drug Safety and pharmaceutical companies. And this clearly played a very significant role in responding to COVID-19, as you all know. And the number of testing labs was rapidly expanded to including public and private sectors. You can see the number really increased dramatically to 114, and that's around 20,000 samples were processed per day. And also we introduced very innovative sampling method of drive-through and walk-through. So far, around 538 samples tested, and around 2% were positive as of April 16. And obviously, the testing result will tell us who should be isolated. So those will include asymptomatic cases and who should be quarantined. Next, please. And secondly, in terms of tracing the movement and isolation and quarantine, we developed the Safety Protection mobile app for the intensive tracing using GPS. And this was developed by the Ministry of Interior and Safety to keep track of the location to make sure the quarantine people are not breaking the quarantine status. And this will also allow those quarantine people to stay in touch with government officers. But still, the telephone calls will remain as an option. And we also utilize the CCTV analysis and credit card transaction log information. And this will obviously raise the question on privacy, but government actually amended the relevant law after the MERS outbreak to allow this investigation. So next slide shows the safety protection mobile app developed by the Ministry of Interior and Safety. And on the left-hand side, this is the safety protection mobile app. On the right-hand side, the app for the government offices. And we also developed COVID-19 smart management system. This was co-developed by the Ministry of Land and Infrastructure and Transport and Ministry of Science and ICT and Korea CDC. And this has been operated from March 26. So with that, actually the very fast contact tracing is possible. It used to take about 24 hours for the investigation. Now with this system, it takes only 10 minutes. And automatically all the data will be handled. And also in terms of privacy issue, there will be more strict management of personal data. Next slide, please. And government also introduced special entry procedures. And these special entry procedures were expanded to all incoming travelers starting from March 19th. So this applies to both Korean and foreign nationals. We also began the testing of all travelers coming from Europe and US. And government will hold them for 24 hours until the test results are available. And even if the test results are negative, all travelers must go into the 14 days of self-quarantine. Next slide, please. And then lastly, for the treatment, the government established the classification system based on the severity and arranged community treatment centers for mild cases to prevent the overwhelming of the hospitals to enable severe patients to be properly treated at hospitals. So mild cases were isolated and monitored at community treatment center, and the government officer will monitor them twice a day. And as of March 23, 329 hospitals were designated as COVID-19 hospital, while ensuring the hospital accessibility and safety of non-COVID-19 patients. Next slide, please. And this photo shows the community treatment center. It has been operated for the mild cases. And as of March 15, there were 16 centers accommodating 2,620 mild cases. Next slide, please. So in terms of social distancing, school closure and cancellation of major events started from the early stage of outbreak. Government extended strict social distancing now until April 19. And actually school began since April 9 by online system. The risk of communication has been very important part, as I mentioned, and media briefing has been done twice a day since the first case was reported. And I think the message was very transparent and clear, and this will enhance public trust in government, and I think that somehow demonstrated as a result of the election which happened 2 days ago here in Korea. An important thing is the message should be really coordinated from all levels of the government. Next slide, please. And there has been some criticism about the WHO's slow action, but I just want to share with you some guidelines prepared by the WHO, such as strategic preparedness and response plan, and also the research roadmap for the COVID-19 has been coordinated by WHO. Next slide, please. And I want to show this slide because this was published just 2 days ago. This is the global strategy to respond to COVID-19 with the 5 strategic objectives, and you can just see the part which are indicated in a blue color. It does say about some restrictions on non-essential domestic and international travel to suppress community transmission. Next slide, please. So what are the lessons learned from the COVID-19 outbreak so far? The outbreak is still ongoing, but I think during the course of the response, we now note that early action is the key. And also Asian countries with some previous experience from MERS or SARS performed quite well, like Korea, Hong Kong, and Taiwan. Singapore actually has some I think, increase of cases recently. And also the whole of government and society approach with the good coordination between the central and local government, different ministries, and public and private and academic societies will be very critical. And the risk communication, of course, as I mentioned. Next slide, please. So as a way forward, I think we still need to work harder to analyze our data accumulated so far. So more timely and robust analysis of epi and clinical data would be needed. And I think we also need more number of people in public health area. And in case of surge of the patient, I think we still need to strengthen our infrastructure. And interministerial and public-private collaboration has been done quite well, but we still also need to apply that for the R&D investment. And the collaboration with the WHO and global initiatives such as CEPI and GLOBIT would be also needed. Next slide, please. I just want to share this slide to show you some website which I indicated in blue, and this has been the project by some volunteers in US, because there has been many requests for the guideline from Korea, so they have translated all those guidelines for local government into English, so you can see those the document translated in that website. Next please. So there has been many requests from other countries for the Korea's to share the Korea's experience. So there has been many interviews, I think, from all levels, and there has been the foreign minister's interview on BBC, and also our president speech during the G20 summit, emphasizing the openness and transparency and democracy on the March 26th. And there has been many requests from countries to learn from Korea, and also requests for testing kits. And I understand there will be the keynote speech of the president during World Health Assembly to share our experience. And he will be probably talking about the Korea success model for COVID-19. And I hope that the current state of the controlling COVID-19 will continue, and we can really talk about how we could be successful to control COVID-19 during that keynote speech. So I want to thank you for everyone for your attention, and I'd be happy to take any questions later.